Upadrava Samjnaka. According to Dallana, these are the Upadravas along with the main disease. And Purva Rupena Upastitaha, Bahuroga Purogama. Before occurring of the Rajyakshma, there are previous diseases occur. See, Purva Rupa is actually some symptoms. In Rajyakshma, disease itself occurs as Purva Rupa. And this is very difficult to understand and cure. Durvijneyo, Durnivaro, Shosho, Mahabalaha. This is Durvijneya. Tridosha Lingatvat, Amshamsha, Kalpana. By these things, we, Bala Vikalpa Adi, we cannot assess easily in this Rajyakshma disease. So this is Durvijneya. This assessment is needed to fix which type of treatment and how we have to go ahead. For that, jnana of the disease, that is by the amshamsa kalpana of the doshas, and which kriya kala stage is there, that also we have to assess. For it is difficult in this disease. Turnivaro and shoshanam paraspara viruddhopakarmatvat dosha shoshakaraka doshanam treatment is viruddhopakrama. Just like if you this is sosha pradana, means dhatukshaya needs brahmana chikitsa or vatahara chikitsa. Vata is prakupita. But if you are giving vata chikitsa, again sroto avarodhata guru gunadi maybe affect the condition worse. So it is difficult to even treatment as viruddhopakrama. So this disease very powerful due to strength of the involving the body related with the samprapti ghatakas, so becomes very powerful. So by this condition, it is difficult to understand the disease and understand samprapti and clear the conditions. Third one is, this is also from the Sushruta, Samsoshanat Rasadinam Shosha Ityabhidiyate. Rasadi dhatu, all are becoming kshaya. It is dried due to the dosha prabhava. So this is known as shosha. Another important nirukti is telling kriya kshayakaratvacha kshaya ityuchyate. Kriya, what is the kriya of our body? This is physiological functions are disturbed. Kaya, vak, manasam, va karma. These three karma we are doing. All the karma becomes weaker. So this becomes as kriya kshayakarakatva. So this disease is known as kshaya. And another word meaning is that kriya means treatment. Even though we are doing the treatment, the methods and the medicines going not effective. So chikitsa kshayakarat. Chikitsa also becomes less and less possible. So this is known as kshaya. In another condition is telling deha maushadam cha kshinotiti kshaya. This is the clear elaborated meaning from the Sushruta in Ashtanga Hridaya Nidhanasthana. Vyadhi stays in the body for a long time. Bahutaram kalam avatishtate. Nacha shamayanti gacchati. It will not go and it will not subside. So, due to the disease effect, deha kshiyate. And aushadhi also, availability or effective medicines also become less and lesser. So, this is known as kshaya, kshinatiti kshaya. And the disease develops dhatu kshayatvat. Shukradi kshayatvat sambhavati iti kshaya, and also rasadi kshayatvat also. This reference from the Ashtanga Hridaya Nidhanasthana, he is informing specially for dhatu kshaya nidhana. See, in other conditions, one by one dhatu kshaya occurs. Whereas there is involvement of the Agni, Srotas, and all are there, and dosha vikopa is there. But in the Shukradi kshaya, Viloma kshaya Rajyakshma, it starts with a long prakopa of Vata. Due to the Vata prakopa, the other pathological changes occurs. So this is a typical condition of pathology. So he is telling Shukradi kshayat sambhavati iti kshaya. So this is also kshaya. And he is telling karya karanayoho abhedatvat upacharati. Hemadri tika is told. And there are two tikas are there. Hemadri and Arunadatta. Maximum I am taken from the Arunadatta. This is Karyakaranayo Abhedo Upachara. So treatment is the same, whatever may be the Kshaya, Viloma or Anuloma. So it is known as Kshaya. Otherwise, we can tell Viloma Kshaya, this is not Rajyakshma, this is another petal. No. The Samprapti after developing of the disease the same, effect is the same. It is the root cause is from other side. So he is considered as Karya Karanayo Abhedo Upacharat. Upachara in the treatment there is no difference. So it is known as Kshaya. Yasmat sa Rajnah Prak Asit iti Rajyakshma Tato Mataha. This is from Charaka. The disease first developed in Chandrama. Chandrama had stars, his wives, and Daksha Prajapati is the father of stars. And some problem is there, and Chandrama neglected his all wives except one. So Daksha Prajapati cursed Chandrama to become Kshaya, Kshinaya or Nasha. So Chandrama is known as king of stars. Nakshatranam cha Dvijanam. Dvija Brahmins. They are regularly counting where is Chandrama from the starting day itself. So that Raja got the Kshaya first. So this is known as Rajyakshma. Raja affected by the Kshaya. So Rajyakshma. And here for the Chandrama, the treatment is done by Ashwini. Chandrama again go and asked and requested Daksha Prajapati for the treatment and remove from. Then he advised to take treatment and blessed the Chandrama. Then he become okay. All the shinings, all the kala, he becomes full. So Ashwibhyam Chikitsito Bhavat Abhut. He treated by the Ashwini Umaras. Now, this is how a disease occurs, and what is the brief introduction is given in our Ayurvedic textbooks. Now, there are 4 types of Rajyakshmas. According to the pathogenesis, they are classified in this way. First one is Sahasajanya Rajyakshma. Sahasa means the work we do more than our strength. It may be running, exercise, fighting, or stressful, strainful works. Even may be our jobs. This makes Vata Vriddhi in our body. But is specifically telling about the wrestling, Vyayama, or Advagamana, these things continuously doing without thinking our body. This is known as Sahasa. Due to this Sahasa, Urakshata occurs due to the Vata Prakopa, and generally in our more body work, we breathe more and more. Still works. So that time, Urasthane Kshata or injury occurs. Even a little injury in the Ura, it is a very sensational part and protected the bony cage. And there is Kshata makes Vata Purana. The Kshata means there is a Riktatva, a emptiness. That immediately Vata comes there and Purana. And this Vata is Asthaniya Vata. So this makes Udirana of the other doshas. So Anya dosha Udirana and Vata is the main reason. Vata mix with them, makes Udirana of Kapha Pitta and mix with them. Now this is a combination of Tridosha. This is very powerful, active due to the Vata Pradhanatva. So Vata is having the capacity making Sarva Sharira Gamana, Urdhvada Tiryak, all the roots it will go. And it able to make Anya Sthana Gatatva, make the doshas to take to other places. So here, this first section completes here with the spreading of the doshas. If it reaches to the Shira Vikriti, Shira Shula, Gaurava, Veda, this occurs. Pranava Srotas, Shwasa, Pinasadi, Kante, Kantodvikriti, Swarabheda, this occurs. This is due to the Urdhvagamana and Tiryagamana. Next, Ura. In the local place, it develops Shula. These are the symptoms when Tridosha travels in the body and settles in different places. Sthana Samshraya. In the Annava Srotas, particularly Urdhva Bhaga, it may develop Vamana or Aruchi and Bhakta Dvesha, all these things related with the digestion. And generally we feel this is related to the gastritis. And it goes to the lower part of the Annava Srotas, Pakvashaya, then it can develop Atisara. And if it is spreading throughout the body, it makes Sarvanga Grahana, Angamarda, Shosha, Jrimba. This is just like Dwara Samprapti. And if settles in the Abhyantara Rogamarga or Gambhira Rogamarga, then in the joints, bigger joints or smaller, develops Graha and Shota, Shula. These are occurs. See, now here, this is the same condition of the Jwara Samprapti. In the Jwara Samprapti also, from the Amashaya, dosha travels throughout the body. And here again, Agni is disturbed in Amashaya. When the Agni is disturbed, the digestion also become weaker. Though Ama slowly or in some quantity develops. Now along with the Ama or Kapha Pradhana dosha, this Tridosha settles or affect in the Rasadhatu. Then Svedavarodha develops, and due to the Agni traveling in the Rasadhatu, Jwara may develop. Annava Srotas is the main vitiating point to development of the disease. If you see in the center, I have written Agni Dushti, Amotpatti and Jwara. The same Samprapti of Jwara here in the Rajyakshma. This is one condition. See, this is the first stage of development of disease. And then it spreads in the body, and in miliary spread occurs. The second stage is later versions. That is, Ura Sthane Kshata is there. Kshata makes Kasa. And Vayu is having Vimarga Gamana effect. So, this develops a typical type of Kasa, Satata Kasa. In the Kasa, two varieties related with one is Kshata and Kshaya. Both are related to the Rajyakshma. So, Satata Kasa continuous occurs, and with this Kasana and related with the Urakshata. Now pressure increases there in the Kshata and Shonita Stivana develops. See, this is an worsening condition. Shonita Stivana means Ojakshaya, and it is Pranayatana. Blood is one of the Pranayaka. So this develops severe debility in the body. This leads Dhatu Sandhi Shaithilyata. So body becomes Shitila. Shitila means Vata Prakopa, or all the functions are not intact, are disturbed in the Shitila Sharira. It is susceptible for so many diseases. Now, patient is having Satata Kasa, Shonita Stivana, Ojakshaya and Daurbalya. These all conditions leads Shaner Shanei Shosha. So, Shosha occur. This is Sahasajan Shosha, and along with this one, the Annavasroto Dushti, Ama Sancharana and Svedavarodha develops Jwara. Now, Jwara is along with the Shosha. See, this is the condition of Rajyakshma. Without Jwara, Rajyakshma is not completed. And it is having so many problems in our other body, other places. Anya Sthana Samshraya. This known as Aneka Upadravena Upadrutaha. This Upadrava leads Upashoshana. So, related to the main loss of Rakta and Satata Kasa Sandhi Shaitilyata, Ojakshaya, Tivra Daurbalyata, Shosha develops. And Aneka Upadrava makes again Shosha. This is double effect. And the Pradhana Vyadhi in the Rajyakshma is Jwara. So, Jwara associated with the Shosha and Aneka Upadrava. Now, this is known as Rajyakshma. Next slide. See, what is the speciality here? What the Samprapti Ghatakas we have to think here? That is Samprapti Ghatakas, Dosha, Dusha, Srota, Agni, all Avayava, Vyaktistana, Udbhastana, we think. Here, Dosha is Tridosha. Dusha, first is Shonita, next is Rasadhatu. Next, one by one, other dhatus also affected. In the srotas, main effects first is rasava srotas, arnava srotas, raktava srotas with the bleeding, and pranava srotas with the breathing, and others slowly affected. Agni, in the starting, Agni is normal, but when the arnava srotas is affected, chardi, bhaktadvesha, aruchi, this develops, ama starts. And ama in this stage only starts, not in the, from the starting. Agni was also normal, ama was not there. And this appearance develops with the development of the disease when it is in the sanchara, prasarana. And Udbhavasthana is Amashaya. Urasthana is near to that one. The actually place is Urasthana. Even the Urasthana is near to the Urdhva Amashaya. So Kapasthana, Anupurvya, Chikitsa is done here. And Vyaktisthana, generally all the bodies means all the Indriyas and Dhatus. So Indriya, Mana, all are becomes Kshaya in this one. And just a minute. And this is having Vyadhi Sankara. See, in the first time you see, there is one Sahasa, there was Kasa. Due to the Urakshata Kasa. Kasat, Shonita Chakti, Shonita Stivana, Shonita Stivanat, Daurbalya. And one by one other disease also developing. So one disease causes other disease. And one nidana makes different type of diseases, and there is mixing of so many diseases. So Rajyakshma is the specific for Hetvartakarini Roga, Ubhayartakari Roga, and Vyadhi Sankara. Next. Another one is now Vega Sandharana Janya Rajyakshma I have not taken here. It is almost similar with the Urakshata Janya Rajyakshma. Only the thing, without Urakshata, pathology is the same. Vega Sandharana develops Tivra, Prabala, Vata Prakopa, and due to Vata Prakopa, same all dhatus are affected, all the body is affected. So this is generally takes some time, not immediate. Repeated Vega Sandharana develops the condition. The next point is Rajyakshma, Vishamashana Janya. Vishamashana Janya, Ahara Vidhi Visheshayatana is neglected. There are 8 parts. And Vishamashana, due to the Vishamashana, it is Tridosha Karaka. Vishamashana is Tridosha Karaka, not Apachana only. And it affects the Agni also. Agni Dushti, Tridosha Vaishamya simultaneously occurs. Due to the Tridosha Vaishamya leads Tridosha Prakopa. This occurs in Grahani, Amashaya, and Annavasrotas. So here again Agni Dushti occurs due to the Samipyatvad. Jataragni Dushti occurs. When Jataragni Dushti occurs, see Agni Dushti in the left one, Apachana and Amotpatti. Amotpatti leads Agni Mandata. Again, this is in the Agnisthana. So, Amotpatti, again Agni Mandyata is there. So, Ahara is unable to convert into Rasadhatu. Ahara first in the 3 stages. Avastapaka is there. Next, Nishtapaka. Next, Ahara Sara Rasa. Then goes to the Rasadhatu. See, all here, the Jataragni works up to the Nishtapaka. Then in the Rasadhatu works the Rasadhattvagni. In the Jataragni itself, these stages are delayed or not properly completed, and Ahara Sara is not completely prepared. Now, the Sara portion is along with the Malamsha, which is not digested, or Kittamsha also. Agni differentiates the Sara Bhaga and Kitta Bhaga. So, this is not completed due to the Agni Mandata. So, Ahara Sara is along with the Malabhaga. So, Rasadhatu Poshana is disturbed, which is digested, unable to digest. And Malamsha is there. So, this is indigested materials, Malamsha, and with the Saradhatu. So, this contains Kapha Pradhana. Rasadhatu is Kapha Pradhana. And Ama is also there. So, in the Rasadhatu, Rasavasrotas, again it blocks. Partially, Avarodhata may develop. And again, Poshana is lesser. This continues one by one dhatus. So other dhatu Poshana becomes lesser, but starting more in the Rasa dhatu, next one by one comparatively lesser. So two things occurs along with the apachana. One is Sroto Avarodhata related with the apachita ahara, ahama or malamsha. And other thing is Poshanamsha Abhava. So Dhatu Kshaya develops. Sroto Avarodhata in the Dhatu Srotas also, and the same time Poshanamsha Bhavat also Kshaya. The two types of Kshaya develops in the Dhatus. So Dhatu Kshaya develops. Again, if you are seeing in the central point, Tridosha Prakopa. See, this makes the Agni Dushti, which is potentially a vicious circle related with the Nidana and the Sthaniya Tridosha Prakopa. Now, these Tridosha travels throughout the body along with the Rasadhatu and just like Sahasajanya. This is the common samprapti in all diseases. From Amashaya traveling throughout the body. According to the Prakopa of the doshas and Viseshan of the Vata Dushti, and its Prakopa, how much is there? According to that one, this rapidly travels throughout the body in different directions. So, Aneka Upadrava develops and also Jora develops. The next stage is Sroto Mukha Avarodha. When this Tridosha travels in the body, throughout the body, this is the main one. And Kapha Pradhana Dosha is there, Ama is there, Apachita is there, Mala is there. All these, when traveling in the body and Dhatu to mother Dhatu also makes Avarodha. So this is Sroto Avarodha Pradhana Rajyakshma. Kapha Pradhane Doshai Avarodha. It is the key one. So this disturbs the main Sharira Chayapachakra is disturbed in Dhatu Samvahana. Traveling one place to other place. Parivartana, Dhatu Parivartana. And in the Gamane Avarodhata. Sroto Avarodhata. This makes Dhatu Kshaya. So Dhatu Kshaya is the main one related with the Sroto Avarodha. In the left side you see, just lower side, just lower from, okay. Tridosha Prakopa having three effects. One is Sharira Gamana, other one is Agni Dushti, another one is that it is near to the Urasthana from Amasha. So Tridoshatvat, Vata, Vilomagatitvat and Kanthodvamsa will be there when the dosha is traveling. So due to these three things, Satatakasa develop. This Satatakasa only Kshata is not there. That Satatakasa makes Kshata or Shonitagamana. Shonitagamana is Pranayatana Dushti and that leads to Dhatukshaya, as we discussed in the Sahasajanya. See, here the four stages of Dhatukshaya is there. One is related to the Shonita Gamana, Dhatukshaya. Other one is Dhatu Samvahana Parivartane Avarodhata, that is also Dhatukshaya due to the Jwara. Also, this is chronic standing. Jwara will not subside in a small, short time. So, in the long term, Jwara makes Shosha due to the Jwara and Vata. This develops Shosha. And Aneka Upada, just a minute. Dhatu Poshana Abhava due to the Srota Avarada and Poshaka Rasa Abhava. That also leads Dhatukshaya. So four types of Dhatukshaya occurs here. One is related with the Shonita Gamana, other one is related to the main Samprapti condition, that is Dhatu Samana Parivartana is affected, Jwara is affected, and Poshana Rasa Abhava also affected. So these four types of Dhatukshaya leads Shosha. Okay, no, little lower. Now, Dhatu Kshaya related with the Shonita Gamana makes Dhatu Avayavadishu Ati Daurbalyata, very weakness. Its function is disturbed in the body. Dhatu Kshaya, it is in the Dhatu itself. It becomes less in quantity. Shosha, water may be Dhatu is there, it is dried due to the Jwara. And Kshaya of Indriya and Dhatu, that is related with the Poshana Bhava. Indriya needs Ahara. Our Koshtanga, Dhatu all needs Ahara. Ahara nourishment is poor. So Indriyas also become kshaya, manasa karma, indriyanam karma becomes weaker. Next slide. That's in Kannada. I will describe in the chart. In the Vishamashanajanya Rajyakshma, see what are the importance in the change in the Samprapti. That is, number one is Sruto Aurada. Sruto Aurada affect everywhere in the body. So this is Sruto Avroda Pradhana Rajyakshma. And previous two, Vega Sandharana and Urakshata. That is, Urakshata is important and Dosha Vata is more important. And Agnimandya always stays in this one. Agnimandya is a more problem one. And Sa Amatva and Ama Sanchayatva. All the conditions are there. Wherever see, everywhere Ama is there. And Ama Sanchaya develops. So Amshamsha Rupena, Ama stays with the dosha, Sharira Gamana and Mala. Along with the Mala also, Ama will be there. And Poshaka Rasa, Adhika Matra mein maximum portion is along with the Mala. Malamsha is there in the Poshaka Rasa. First develops Rasakshaya. And that leads Ojakshaya. Stula Ojas is along with the Rasa. So Rasakshaya and Malamsha Adhikatva, Poshakamsha Abhava. This develops Ojakshaya. So this is pathological condition different than others. Next. Yeah. Now is Dhatukshayajanya. So in the food, we should always care about such development of the diseases. In the malnutrition, stress, we can find these conditions of Vishamashanajanya Rajyakshma. So it is also good, bad condition. And other thing, in the malnutrition or improper diet, immunity power becomes weaker. So according to modern also, good nourishment is needed for a resistant, good, healthy body. In our condition, Agni and Poshana Rasa, Poshakatva, it is important. So everyone should be careful for the food. So in the Ayurveda, very detailed background is given about the food. Which type of foods, what are the quality, and how we have to think about the foods. There are Vidhi, Ahara Vidhi Vishesha Ayatana that we have to follow. So, if so, the food always keep our body stable, even though it is Sharira is Shiryatiti Sharira, that is prevented. Now, Dhatukshayajanya Rajyakshma. Here, Dhatukshaya is important in this section. Some disease develops due to the Dhatukshaya only. So they are telling about the Dhatukshaya. One is Anulomakshaya, other one is Vilomakshaya. See, Ruksha Annapana Janito Raktadi Kshayo Api Rajyakshma Karanatvenoptaha. This is from Chakrapani. And Ruksha Annapana makes low nourishment. Ahara Vidhi Visheshana Vishamashanajanya, there is Apachana. And digestion is disturbed. Here digestion is normal. But Poshana factors are very less. Generally, we have to take more Madhura Rasa. Snigdha also we have to take. Very less Ruksha and Katutiktari. But we are taking more about the Katutikta Vidahi Ruksha Annapana. Then Poshana Tattva is comparatively lesser. This type of food or malnourishment. Yes. This is one of the reason. Another reason is Shoka, Bhaya, Chinta, Isha, Krodha. These bhavas makes Agni Mandata or indigestion and Dhatu Parivartana disturbs. So one type of depression or Bhaya, afraidness, paranoid conditions, Chinta, stress, all makes Ahara, Sara, Prutatva becomes lesser and Poshana Rasa will be lesser. Same time, Agni also become weaker. Now, so what is the effect? So, Poshana Agni is there. It is making digestion comparatively lesser. Poshana is lesser. If more Ahara is there, then Ama will develop. Here, for the Ama purpose, requirement of huge quantity is not there. Quantity is also very less. And it is easily digestible. So, it digests, but insufficient nourishment is there. That makes Hridayastha Rasakshaya, not in the body. Rasa center is Hridaya, traveling in the body. It reaches all the dhatus, all the places. So, from the Hridayastha, which is near to the Annava Srotas, from the Annava Srotas, go to the Hridaya, then Rasa Dhatu travels throughout the body. Here, Raktakshaya develops due to the proportion from the rasa dhatu is comparatively lesser. So, same way, further dhatus becomes kshaya, mamsa kshaya, meda kshaya, and asti kshaya, oja kshaya, and shukra kshaya. This is known as anuloma kshaya. See, this won't occur in a short time. This needs a long time. And if the nourishment, Agnidipane and Sneyanadi we do, then this will be clear. This is first of all Shosha. In Sushruta, you can find different type of Shosha. It is only Shosha, not Rajyakshma. If it is included with the other Upadravas and Jvara, then becomes Rajyakshma. So this is only Shosha condition. And Shukrakshaya leads, now all the Saptadhatus are weaker, means that's definitely Vata Pravruddhi. Even one Dhatu Kshaya also lead to increase in the Vata Prakopa. Now all the Dhatus as much as reaching to the Shukra Dhatu, then definitely there will be a very good Prakopa of the Vata. Vata, two internal factors or Vata Prakopa. One is Avarana, other one is Dhatu Kshaya. So Dhatu Kshaya also makes very Prabala Vata Prakopa. This again, Prakopita Vata travel throughout the body, and throughout the body, in the whole body, make Kapha Pitta Udirana. Then again Jvara Samprati and other Sampratis develops. So first of all, Dhatu Kshaya is the main thing here. And once Tridosha Prakopa starts, then the Samprapti of Rajyakshma will develop. And Tridosha Prakopa leads Aneka Upadrava, and Shosha will develop. Along with the Jvara, it is Rajyakshma. Now, there is an Viloma Kshaya. This is also told in the Charaka. So, is this the fifth one? No, it is not so. This is a part of the Nidana, etiology. So, the treatment method and pathology when develops after the pathogenesis is common. It is the same. So, this considers a part of Nidana of Rajyakshma. Hetu. Shoshakarneshu kshayeshu kevala only Shukra Kshaya Upasamanam Pradhanyatvat. Shukra Kshaya is more important in this condition due to that one. How this occurs? Sadhyo Shukrahari Narihi. So in the Maithuna, Ati Maithuna causes severe loss of Shukra. So Shukra ka atyanta kshinata, due to this one, if the pravritti is not stopped, makes apravritti of the Shukra. So Shukra apravritti, this is just like IDF. And he always try and depress psychologically. So that time he try to more and more with any simulations or however what they do. Then local, due to the Shukra Kshaya, local Vata Prakopa will be there. This is Apanavayu. Apanavayu Prakopa and then Shukra was Rotas. Vata Prakopa, Shukra or Moolasthana in the Sthana and Vrushana. From there, Vata becomes Vimarga Gamana and becomes more Prakopa. Vimarga Gamana, Avarana, both makes Vata Tivra Prakopa. So, Prakupita Vata, Samipya Dhatu, that is Majja. Majjam Upashosheti Samipyatat. Sanidhyatvat Majjam Shosheti. Evam Purvapavra Dhatun. This is written in the Vijay Rakshita Tika, Madhavanidhana. This is Upashosheti due to the Vata. Vata increases the Dhatwagni. In the Dhatwagni in the Shukra Srotas and Majja Srotas. So, Majja Dhatu converted faster to Shukra Dhatu. So, what will happen in the Majja Dhatu? Majja Kshaya. So, Majja Kshaya, again, this is not stopped or continued, then Majja Kshaya leads reverse Kshaya of Asti. So on, up to the Rasa Kshaya can Vinomaritena Pradurbhavati. It can occur reverse type of process. Now, this is one type of Shosha, Viloma Shosha. Now, what happens in the Apanavata there? In the Apanavata, this Vayu enters into the Dhamani. From the Dhamani, It is also traveling in the same place. Dhamani, Sira are the different srotas. In the Dhamani, blood is there. Pulsing will be there. So here, Vata Vimarga Gamana will be there, and from Shukrava Srotas, it will uh, uh, bleeds the Shonita Pravritti. From Shukrava, so instead of Shukra, blood will come due to the Vimarga Gamana of the Vata in traveling to the Dhamani. So Shonita Pravritti leads because of Shukrakshaya, Shonita Gamana, Sharira Shaitilyata. Shukrakshina makes Sharira Shaitilyata. Shukra is important for Sharira Dhridatva. Sharira Shaitilyata and Raukshadi. Shukra is one of the top Snigdha Dhatu, Sneha. So Sneha is lesser, so Rauksha will develop. And due to these conditions, Atyanta Daurbala, severe debility will develop. See, Sukrakshaya, Bala, it will be lesser. Shonitagamana, Pranayatama is lesser. Sharira Shaitilata, Daurbalata will be there. And Raukshata will be there. So, this makes again Sarvadaika generalized Vata Prakopa. So, with the Vimargagamana of the Vata and Saptadhatu Kshaya, here Vata Prakopa having two basic factors. One is Raukshata and severe Daurbalyata, its work is increased, and Dhatukshaya. So this is Prabala Prakupita Vata travel throughout the body and mix up in the different other doshas. It not only in the abdomen or grani, it all in the body, different places. It will Udirana of other doshas makes Tridosha Prakupita Sthiti. So this Tridosha along with the Prakupita dosha Vata makes Sahajanyavat Samprapti circulation. So this leads Shosha and same as Jvara and Ojakshaya due to the Shukrakshaya. Shukra is before the Ojas, Saradhatu. So and Dhatukshaya is also there, and Ojakshaya will be more. Shukrakshaya, Ojakshaya is more affected here. This Ojakshaya, Raktakshaya, and Dhatukshaya, all known as Kshaya. Tridosha Prakupita Tridosha makes Shosha in the body, and Jvara also makes Shosha. So, Apratikarat Anubhadyate Rajyakshma. If this takes not only short time, this takes more time. So, Apratikara if not done, then it will turn into Rajyakshma. Next. What is the speciality in this one, Samprapti? That is Dhatukshaya Pradhana Ubhaya Hetujanya. Two types of Dhatukshaya occurs, Anulomakshaya, Vilomakshaya, and Ativruddhi of Vata and Vimargagam. Prakupita Vata, Vimargagamana will be there, and along with that one, Dhatukshaya and Vata Prakopa makes Dhatu Shoshana. Dhatukshaya, Vata Vriddhi is the pathological condition where we have to treat. That is Rasayana Vajikarana and Vata Shamana. In the Vata Vyadhi diseases, Charaka is telling, all the Rasayanas and Vajikarana medicines are Vatahana. See here, both purpose can be cleared along with the Rasayana Aushadhis. Next. Now, the pathogenesis, the different method it occurs. Once the pathogenesis is completed, then there will be Samprapti, how the disease continues. It is stable. This is common, all type of Rajyakshmas. Once Rajyakshma is established, then three pathological conditions are there, pathology is there. One is Srotasam Sannirodhacha. Sroto Arodha is there, everywhere. Not only Annavaro, Rasava. Every Srotas makes Avarodhata. In some factors, Avarodha in some dhatus may be more. Vishamashanajanya, Rasadhatu is more. And in the Vilomakshaya, Shukrava Srotas, Shosha is there. Raktadinam Chaksham Chayat. See, it's not telling about the Rasadhatu. Raktaditatu becoming Kshina. And the third one is Dhatu Ushpanam Cha Apachayat Rajyakshma Pravartate. It will continue along with the three conditions. Dhatushpanam cha apachayat, dhatu poshana will not be there. Raktadi, rasadhatu is near to the ahara sara bhaga. And so many part of the poshana amsha also with the mala and rasa also with the mala. So rasa is comparatively less kshaya. And in Viloma Kshayajanya, Rasadhatu Kshaya occurs in the later time. And only in the Poshaka Rasa Abhava, Anuloma Kshaya, Rasadhatu becomes Kshina from the starting. And Dhatu Ushmana, Dhatu Kshaya also occurs. What are the reasons? In the Srotasam Sanirodhat, it is Yakshmakaraka Doshena Avaruddhatvat. Yakshakaraka dosa one is Vata makes Avarna. And Tridosha makes Ama and Avarna. Kapha Pradhana dosha, Yakshmakaraka dosha is telling because it is Kapha Pradhana dosha also along with the Avarna of Vata. Raktadinam cha samkshayat. So why the Rakta Dhatu becomes weaker? That is Poshak Rasa Aprabalya cha. Sufficient Poshak Rasa is not available. And Sroto Avarodhata is there, so Dhatu Kshaya occurs. Another thing, third one, Dhatu Ushpanam cha apachayat. Dhatu Jataragni becomes disturbed. Along with that one, Dhatu Ushma also becomes weaker, which situates in the Srotas. This is due to the Dhatu Kshayat and Dosha Prabhavacha. For the Agni, nourishment of the Agni is from the food. Just like fuel for the fire, same way, Dhatu is important for the Dhatu Agni Prachodara. So, this is lesser. Poshakrasa is lesser. So, Agni is weaker. And same way, Dosha Prabhava, the combination of the dosha, as in Vikruti Vishama Samahara effect is there. So, that makes Prabhava and suppress the Dhatu Agni suppress. Now, what we can compare along with the modern science? Rajyakshma is identified along its pathological conditions and symptoms. In the Rajyakshma, we can compare with the pulmonary tuberculosis. One thing, this is most similar development, generalized miliary spread and secondary development. That is Sahasajanya Rajyakshma is almost similar. And interstitial lung disease, ILD. In the same also, Rajyakshma symptoms are developing. It is very difficult to cure. Other things are malignancy. In the any other places may develop Dhatu Shoshana, Dhatu Kshaya, Indriya Kshaya, Manodhat all develops. So, according to pathological conditions, malignancy of some conditions also can be taken in the 4 types. Other one is Dhatu Kshayajanya is related to acquired immunodeficiency syndrome, HIV infection. That is Dhatu Kshayajanya we can compare. And this is related to the Nidana of the Rajyakshma. In the treatment section, this is having Ahara, Vihara and Vishajani. General Rajyakshma we think as no Shodhana, but it is not so. This is mainly Shamana Chikitsa is important. The first point is telling from the Charaka, Sarvat Tridoshajo Yakshma, Doshanam tu Balabalam, Yakshmam Avastikam Vaidyaha, Shoshinam Samupacharet. This is very Sutravat. See, Sarvat Tridosha Rajyakshma. Rajyakshma is Tridoshaja. So, we have to treat along to the Taratama Bhava of the dosha, Tridoshas. And Avastikam Vaidya, we should also assess which stage is that, which part of the body is affected. Accordingly, Doshasya and Rogasya stage Avastha, Pravutta, Prasara, Sanchaya, all this we have to think about the doshas. Accordingly, we have to treat. Next, the important of Jora is given in the Sutra of Trirupa Rajyakshma. I have not made a slide. That is, no slide is there. And Trirupa Rajyakshma is told as Amsa Parshvapitapaha Santapaha Karapadayo Jora Sarvangascheti Trirupa Rajyakshma. It is told. And see, this is Santapa, Daha, Jvara. All are the same feeling, that is sitting near to the fire, hotness. That is Jvara, Santapa, Daha. So, what is the difference? Why is telling that Amsa Parshvayo, Santapa, Karapadayo, Daha, and Jvara Pura whole body? Means whole body is becoming hotness. It means it is typical type of fever, Vishamajvara. In the Karapada Talayoho, there is more fever. Hamsa Parshvascha, Hamsa Pradesha and Parsh Pradesha also more fever. Other places fever is there, comparatively lesser. So this is one type of Vishamajvara. This stands long time. So Jirinajvara. And this is Sannipata Jvara. So Sannipata Jvara, Jirna Jvara, and Vishama Jvara. These conditions are there in this one. So Jvara is very powerful. Another thing, this is Dhatugata Jvara. Jvara affecting in the Dhatus. But even the powerful, Vega is not so much severe. It is only Santapada is limited. And in the Jvara treatment, if it is there, Madhya Jvara, Jirna Jvara, Vishama Jvara Chikitsa, according to the stages we have to do. Here, Ama Jvara, Navajvara, Langhanadi, Nisheda. Grita, Kshiradi, Aushadha, Veshajani, Prayogaha. Jvaranam Shamaniyo Yaha Purvamukta, Jvaranam Shamaniyo Yaha Purvam Ukta Kriya Vidhi. All the method of treatment, Yakshmina Jvara Daheshu Sarvo Api Prashasyati. This is written in the Vaishyajaratnavani. I think this is taken from the Yogaratnakar. So Jvara Chikitsa is done. Other one is Samprapti Viparita Chikitsa. This is also one of the important treatment told in the Rajyakshma. This is Shamana Chikitsa. Rajyakshma develops due to the Srotasam Sannirodha. Madhyapana, Madhya is Vyavai Vikashi. So, due to the Vikashi and having contained the medicines, this is Sroto Avarodhara. Raktadinam Samkshayat. So, Dhatu Poshana should be there. Dhatu Ushma, Dhatu Agni also increased. So, Asavarishtas, Madhyapana is the number one anti Samprapti Viparita Chikitsa. That is Vyavai Vikasi makes Sroto Shuddhi, and Asavarishta itself is Agnideepakaraka, Pachaka, and it contains medicines, Dosha Shamaka, and same way it is Dhatu Pushtikara. So Asavarishta is highly appreciated in the Rajyakshma treatment. Generally, this is given as main drug, but some powerful medicines we have to give to remove the Tridosha Sanghata. For that purpose, generally, I prefer in my school of thoughts, Rasaushadis are used. Next, Shodhana. Shodhana can be done if patient is suitable. That is, Balino Bahudoshasya Panchakarmani Karyat. If the Sharira Bala, Manasika Bala is good, he can do his activities, then Panchakarma can be done. Panchakarma, Vamana and Virechana or Astapana or Bastis. Yakshmina Kshina Dehasya. If the person is lean, weight loss is there, wasting is there, then Tat Kritam Syat Vishopamam. Visha, Agni, Ashani, these kills immediately. So, just like that, an immediate patient may collapse. And in the Rajyakshma, Malayattam Balam Pumsam, Shukrayattam cha Jeevitam, Tasmad Yatnena Samrakshayet, Yakshmino Malaretasi. So, Malayattam Balam Pumsam, the strength of the Rajyakshma Rogi is basically stays along with the Mala, because Ahara is not properly digested and not properly differentiated as Malabhaga and Sarabhaga. So, if Mala is standing for more time, some of the portion will give the Bala. And Shukra is the topmost level Dhatu, makes our body having a good strength and Sharira Rakshana. So, Jivana is there, livingness. Tasmat Yatnena Samrakshaya Yakshmino Malaretasi. Doshadikanam vamanam shasyate. In Charaka is given vamanam shasyate sa virechanam sneya svedopapannanam sa svedam yat na karshanam. Karshana, now that type of we can give svedana or shodhana. Next. Over. There are some medicines are there, just informative. This is the Rasaushadis generally used. I have seen in so many Vaidyas. They are treating Rajyakshma. What was surprising, in Ahmedabad, Vellore, there was a Divya Jyoti Foundation, and they are treating so many cancer patients. I don't know now what they are, how they are doing. Previously, there was saint was there. She was treating mainly. They are having master in the Rasaushadis. They in the pulmonary cancers, bronchial cancer and pleural cancer and I don't know other things. They are freely using this one. Mrigankarasa, Raja Mrigankarasa, Maharaja Mrigankarasa. They are giving Lokanatha Rasa, they are giving. I have seen. And patient was surprised recovering. Of course, they are not cleared. They lived more than they anticipated. This is also not a small thing. And they are using Vindhyavasi Yoga, Mrigankarasa. Mrigankarasa is the main drug. Vindhyavasi Yoga and Suvarna Vasanta Malati, particularly for Jwara. Jirna Jwara, Suvarna Vasanta Malati is the best one. But only the thing, it is to be properly prepared. And Shringabhasma and Vishaha, this is Vishara also. Vindhyavasi Yoga, that is particularly for Manakshaya is there. And Makaradhwaja or Purna Chandrodaya Rasa. Suvarna Bhasma and Abraka Bhasma also used. And Gugul, Mahayogaraja Guru, Yogaraja Rasaha, Aishwara Guru, all are used in the different condition of the Rajyakshma. And now, the common medicine Rajyakshma is told in the Charaka, that is Sitopaladi and Talisadi. That is related with the Rasadhatu Shuddhi, Rasadhatu Paustikatva, related with the Sharkara. And it is very good Jataragni Deepti, Pachana, and that Jataragni improves the Agni of the Dhatu. And people is that also makes Pachana and Rasayana also it is that. So Sitopaladi and Talisadi are used. And generally all these Vaidyas who are taking the Rajyakshma, they use everywhere in the Talisadi or the Sitopaladi. And they give the medicine, but generally they mix with other Rasaushadis. And the Sitopaladi and Talisadi also given as a appetizer. Just before the food it is given, and then they tell to take the food. By this, the food digests a good way, nicely digested. And other thing is Brahat Shivagutika. See, Brahat Shivagutika I have not seen in my earlier life, but in the later time, 1997, after 97, I have seen so many Vaidyas using this Brahat Shivagutika. This is told in the Yogaratnakara, Rajyakshma Chikissa. This is also very good Rasayana and Dhatu Parak Aushadhi. Any disease related with the malignancy, AIDS, or tuberculosis. This is drug of the choice, supportive. Any treatment you give, if you are giving the Brahat Shivagutika, this will make body stable and Dhatu Poshana and resistance power will increase. Resistance power is very needed in Rajyakshma, tuberculosis, because it is not so toxic bacteria. Due to some allergy, the resistance power becomes weaker and it is making susceptible to the other infections. So body function may disturb with the less resistance power. One thing. Other thing, cytotoxicity is common with the medications and related with the bacterial changes in the body. So that is also controlled or lessened with the Brahat Shivagutika. Shilajitu is the Sara of the all dhatus. Just like Bhumika Sara and Mercury, it is one of the medicine told having all the properties of all the metals. So if this is given, metals is similar to the dhatus, dhatina or rasaraktari. So this is very good rasadi dhatu poshaka and rasadi dhatu balakaraka. And this is such a treatment we can. If patients come to me, generally I won't handle, and just telling you can take this Brat Shivakutika continuously, and this will definitely help you. Definitely it helps. They can tolerate the power of the modern drug regime. See, they are not giving one powerful drug. They are giving, there is schedule. 3 drug combination, 4 drug regime is there. So if such a drug is given, even a single antibiotic makes so many gastritis, debilitating the body and psychological stress. This can be countered with the Brachyotika and Sitapalabhi or Talisari. These simple things will not affect the effect of the modern medicines, but your patient is capable to handle the treatment. Next. Now, what are the things we have just come across in these things in today's class? That is, Rajyakshma develops and continues with other diseases. It is having so many aneka roga purogama and aneka upadravaiktaha. But who is the main disease? That is Jwara. Trirupa Rajakshma is the Jwara. Rajakshma is having 4 types of pathogenesis. This is the one disease having different type of pathogenesis. And out of them, Dhatuksha is having 2 types. One is Anuloma and other one is Vilomakshaya. This is important. Pathogenesis is related with the treatment. Common samprapti is common. So all the pathogens leads to one type of disease known as Rajyakshma. Common samprapti pathology is there. So Rajyakshma is one disease. See, treatment is difficult. He's telling it is very difficult to cure. So he's telling 2 types of main treatments. One is Yukti Vyapachara Chikitsa. That is our treatment, doctor's side. Other one is Daiva Vyapachara Chikitsa. This is told in every book. So both is to be done in my opinion. And the last word is from my great teacher, Pandit Taranath. व्याधि को पूर्ण रूप से हटाना पूर्ण चिकित्सा है. केवल लक्षण या अमुक संप्राप्ति घटक हटाना अपूर्ण चिकित्सा है. In the Rajyakshma we have to do this, which is very difficult. So we have to completely clear the disease, pathological conditions and pathogenesis conditions from all the places of the body, from the main Vyakti or Udbhavasthana. All the places it is to be cleared. Disease is cleared. Means dosha samurchana, dosha sthaniya samurchana, agnika pravritti and swastha lakshana to be attained. That is the main points in the Rajyakshma. Thank you.
Thank you very much, sir, for your valuable speech. बहुत अच्छा सर लेक्चर रहा आपका. और पर्टिकुलर जो आपने डिफरेंट टाइप्स ऑफ राजयक्ष्मा की जो अलग अलग संप्राप्ति बताई, वो सही में रोग निदान डिपार्टमेंट में से ये वेबिनार हुआ है ऐसा वो दिख रहा है सर. सो थैंक यू वेरी मच अगेन सर. I also thankful to our director madam, Dr. Professor Dr. Tanuja Nesri madam, and our HOD ma'am, Dr. Darshana H. Pandya madam, for continuous positive support. Thank you all.
Thank you. Thank you. Okay, okay. Stop again. Okay. Thank you.